I think the main priority is just to do research. We really want to try and increase capacity, get nurses involved at lots of different levels. Some of the most exciting things for us are CAR T cells. So stem cells generally, the manipulations, there's a lot of really interesting stuff going on, and we'd like to see nurses really at the forefront of this. Nurses tend to be the people that we train to give these cells back, and so they have a lot of technical training about what the cells are and sort of side effects and how to manage these sort of things. But we don't really get them involved as much as we should in the research side of that. What do the research protocols look like? How could they become more involved in that? I think that's going to be important over the next few years. Just because they're important, this is new, this is the way that I think a lot of haematology is going to go with stem cell manipulation. We're going to do a lot more in genetics, I think, a lot more in from different angles that are new. And I think a lot of this stuff is going to generate a lot of psychological opportunities for psychological research. And I think a lot of those areas are where nurses are very good at doing that kind of qualitative research, social science research, that kind of stuff. So I think we're good at it. I think we've got a history with that, and I think we should utilise that more. It's probably changed a lot, but not as much as it should. As I say, we want to build capacity. We want to see more nurses doing research. I'm talking at the BSH conference about building capacity and the problems and pitfalls with that. Some of the traditional problems are still there. There's a real gap between medical and nursing research. There's a gap of perception, there's a gap of quality. But also I think the main issues for us are giving people the time and the permission to do research. And nurses should give themselves the permission to do research.